Thank you all for being here. I am super excited about our progress and I'm feeling very optimistic. Welcome to our April 2025 meeting. As you know, we're trying to pass the End Kidney Death Act. This is a policy proposal to provide for every American who donates a kidney to a stranger a refundable tax credit of $10,000 each year for 5 years. We estimate that this will save up to 100,000 lives and up to $37 billion in taxes. The great news is that I'm confident that the bill will be reintroduced in April. I've heard from the co-leads offices, and I'm just eagerly waiting for that moment when the bill is reintroduced, and you will be the first people to find out about it. There was an article written in JAMA Online, the Journal of the American Medical Association, and that article is entitled "The End Kidney Death Act Risks Irreversible Harm to Organ Donation." The authors of the opinion piece were all at the Declaration of Istanbul meeting that I attended in October. The Declaration of Istanbul dates back to 2008, when a group of international organizations came together to combat transplant tourism. And I've spoken about this in earlier meetings. Every one of their principles I agree with. They're just common sense in opposition to the very damaging rights violation, which is the illicit organ trade, the black market, where 10% of all kidneys are received in the current world that we live in. So the opposition to the black market is something that we can all get behind, but they do have one provision that states that they are opposed to compensation of organ donors under every circumstance. So I attended a meeting last October, and the subject of the meeting was the End Kidney Death Act. And so pretty much I fielded a lot of questions. And the authors of the opinion piece are a nephrologist, Thomas Muller from Switzerland, a liver surgeon from Costa Rica, Dr. Matamoros, Dr. Nagrel from India, a liver, pancreas, and biliary surgeon, and Dr. Danovich, who's practiced in both Israel and the United States, and he's a retired nephrologist. Now, regarding Dr. Muller, he is the leader of the organization, and just to share some of what he shared with us during the meeting, I think it's important for us to all hear it. He said that he's been having meetings in South Africa, India, and Kenya, and meeting participants have asked, do we have to adhere to the rules you are making? They accuse the Declaration of Istanbul group of colonialism. He said that these meetings were confrontational and emotional discussions, accusing us of causing death in opposition to the compensation of organ donors. They called us arrogant, though he said we are open to new ideas. He said that paying donors would do damage to donors who have been altruistic, which of course we know that 98% of donors said that it would not have impeded their donation in a National Kidney Donation Organization survey. He said this will cause damage to altruism and solidarity. We heartily disagree. He said, what if we open up this can of worms of paying donors? He said, I fear that the quality of donations would go down. I argued against him at the meeting, stating, we're not changing the standards, which are quite high, and they will remain so. And so the idea that this is going to change the quality of organs is a spurious argument. And he also expressed great interest in the End Kidney Death Act, invited me to Switzerland to address his group. But then right after the meeting, I was cut off from communication with the group. They have exchanged a number of emails since the meeting. I've not been included on any of them. And so, things changed after the meeting. Now, I just did a little bit of research and I misspelled Switzerland, I just noticed. But yeah, I did some research on all these different countries in terms of what their donation rates are. And at the end, I will show a comparison chart of all of them. But in Switzerland, you can see that their living donation rate is rather low. There's no collected data about how many non-directed donations they have. I'm not sure if they have any at all. But their rate per million of living kidney transplants is relatively high, and they have 40% of people registered as deceased donors. When I look at this, I say to myself, Dr. Muller, you've got a lot of work to do in Switzerland. I'm not quite sure why you're writing about a policy proposal in the United States when you have so much work to do in terms of saving the lives of those who are dying on the wait list. And that is true for all of the authors. The next author, Dr. Matamoros, works in Costa Rica, and she is not connected with kidneys. She's a liver surgeon, but of course, a member of the Declaration of Istanbul's committee. Unknown how many non-directed donors they have in Costa Rica. It's not listed anywhere. They had 69 living donations last year, and only 40% of their population is registered as deceased donors. The next author of the legislation, again, not a kidney related specialist, but a surgeon in India. And the rate of donation is really low in India. 16,000 donors, that's less than you would expect in a country of 1.5 billion. And as you can see, very few people are registered as deceased donors in India, 0.1% of the population. Again, so much work to do in your own country. Curious why you need to state your thoughts about what we're doing over here when your country itself is in desperate need of more donors. And the final author, Dr. Danovich, this is a person I've met before, has practiced in both Israel and the United States. And he historically has been against kidney transplantation from any unrelated living donor. So in other words, all living donors should be within the family. There shouldn't be those who are not related donating to people. And so many people, if we would have listened to Dr. Danovich, would not be alive right now. If we listened to his thoughts about, if we adhered to his thoughts about who should be allowed to transplant, to donate, he said that if we allow unrelated people to donate organs, then this would pave the way for organ trade or commercialization and would undermine the ethical foundation of organ transplantation, and that there may be social and emotional consequences that could complicate the transplant progress. This was said, 40 years ago, or 39 years ago, and didn't come to fruition as he expected. We permit unrelated people to donate, and it goes quite well. And if we limited it to just families, so often families themselves have kidney disease and are unable to be donors. So it's really a death sentence for those who are waiting if we had his restrictions in place. Now, he was also, in the same year, 86, he expressed that he's against non-directed donation. In addition to unrelated donation, he said that he finds the proposal for non-directed donation to be objectionable and unacceptable. Remember, this is 86. It wasn't for 14 years after this period when non-directed donation in the United States became legal. He said such donations would not be an act of love, and it is unclear to me what the prospective donor's motivation would be. It would be exceptionally difficult to be convinced of the purity of the motives of a living stranger donor. So I think that Danovich is a natural opponent to the End Kidney Deaths Act because he really doesn't even believe that those people should be living donors who are not related to the recipient. Again, a perspective that if he had his way would have killed far more people than are already dying from the kidney shortage. Something I think none of us agree with. Now, if you look at Israel, it's a country that compensates kidney donors. There were 243 non-directed donors and only an additional 20 directed donors in Israel. So their non-directed donation program is excellent. As I said, they compensate, but you can see they have a very low percentage of people who are registered as deceased donors in Israel, only 14%. So here's the full chart of everyone. As you can see, the only countries that have a non-directed donation program that publicizes its numbers is USA with about 400, Israel with about 243. So, and of course, Israel is far smaller than the United States. Compensation is the reason why they have so many non-directed donors. And that's what we will have after the End Kidney Deaths Act passes. The rate per million of people who are donating is in the next column. As you can see, Israel is the champion because of their compensation program. In the next column, the number of living kidney donors, and then deceased donation. As you can see, the U.S. program is by far the most robust, and I'm really proud of our program. Every year we exceed our numbers, and I think the people in the deceased donation world are heroes. Then the number of people on the wait list. For a country of 1.5 billion, the number of people on the wait list in India is very small. The number of people with kidney failure, percentage of the population, Unfortunately, the US wins that one. Hopefully, over time, we can reduce that number of people with kidney failure. The year that non-directed donation was legalized, I'm not sure if it's legal in Costa Rica. I couldn't find anything. The US was the first country in the group to legalize non-directed donation. And of course, the percentage of registered deceased donors, I think we have a lot to be proud of, that we have by far the most deceased donors of the group. Now, just to understand, sometimes you gotta say, or a lot of times in this world, a lot of things come down to money. Now, the number of kidney failure patients will rise from 800,000 to 1 million by 2030. So plenty of patients for nephrologists to take care of. But of course, that number will be reduced once the End Kidney Deaths Act passes by a slight amount, the number of 10,000 annually, hopefully once the program ramps up. But the fact is, nephrologists will earn less money after the End Kidney Deaths Act passes. And two of the 4 authors are nephrologists and may be very aware of this money loss. Huh. I did some research here that general nephrologists lose about $6,000 per year per patient that gets transplanted. Dialysis clinic owners, who are sometimes nephrologists, can make between $100,000 and $1 million annually. So there might be nephrologists who are profiting from having their patients not get transplanted because they are partial or full owners of dialysis centers. About 60% of nephrologists are affiliated with corporate dialysis providers. So they have an ownership stake or they work within the corporate structure. And 20% own or invest in smaller independent dialysis clinics. So this is another motivation to not want to get patients transplanted. It's a financial motivation. And of course, we have many nephrologists in our community who are highly supportive of the End Kidney Deaths Act. But there is the American Society of Nephrology, which is not in favor of our bill, as well as the 2 out of 4 authors of the opinion piece in JAMA, nephrologists, probably aware that it will affect the size of their wallet post End Kidney Deaths Act. So money motivation is there. Now, just a reminder, and we've seen this slide before, that the majority of Americans and the medical community are in favor of compensating donors. We have 4 national surveys, which in each one, the majority stated, yes, let's compensate donors. And there was the American Society of Transplant and the American Society of Transplant Surgeons membership surveys in both 2009 and 2015, in which the majority of the members stated, yes, let's have a pilot program for compensating donors. And there, of course, was unanimous support of pilot programs for compensating donors in 2 states that the National Kidney Foundation boards were voted on. That was in both Florida and Arizona. So the majority of people are in favor of the End Kidney Deaths Act. So another question that arises is, why did the American Medical Association's journal publish this opinion piece without providing the alternative perspective, the perspective of us who support the End Kidney Deaths Act? Certainly within our organization, we have plenty of doctors they could have asked to write a piece as well, but they chose not to. So let's look into the American Medical Association for the moment. Now, they have a policy on the page that states that number 3, the AMA will seek legislation necessary to remove legal barriers to research investigating the use of incentives, including valuable considerations, which means money, to increase rates of living and deceased organ donation. So they are in favor of studying what a compensation program will do. I had this on our website. And I got a call from a lawyer from the American Medical Association back in October who stated I needed to take it down. And I talked to him for a really long time. And he said, in other parts of our extensive publications, we're also opposed to compensation. So unless you want to be sued, you better take it down. So I did take it down, but I just wanted to let you know that they do have on the books a policy in favor of a study of compensation. So I started to look into their funding. They get $493 million of revenue annually, and only $34 million of that comes from membership dues. They do receive funding from pharmaceutical companies and dialysis companies. And of course, certain pharmaceuticals will not have as many patients to take them if we can get people off dialysis and get them transplanted. So there is perhaps a financial motivation to the American Medical Association's publication of that opinion piece without first finding out our perspective. They also have faced criticism for their financial ties to pharmaceutical companies and medical device manufacturers, and that they have been accused of prioritizing corporate interests over patient care or public health. They've also lobbied against cost control measures, such as drug price negotiation and insurance reform that has disproportionately impacted low-income individuals and families. And just to give you a sense of how they've been on the wrong side of history, they were opposed to, I said that wrong. So in the mid-20th century, they were slow to speak out about the dangers of smoking and did not fully embrace an anti-smoking campaign until 1964, even though back in the 30s, it was established by scientists that there is a statistical link between smoking and lung cancer. So, they waited 30 years to be in support of anti-smoking campaigns. And many people accuse them of having accused them and said their financial relationships with tobacco companies were prioritized over public health. So I would say they're doing something similar in their way of expressing their opposition to compensating kidney donors, and they will be seen as on the wrong side of history once this bill it passes and saves the lives of those who are desperately waiting for us to get this bill to the finish line. I really like this graphic. It's just, I think, an excellent explanation of where we are. We have 550,000 Americans on dialysis. We have only 6,000 living donors annually, about 22,000 deceased donors annually, and of course, 100,000 deaths annually from the kidney wait list. So this is a tragedy, and we are the agents of change who will fix this problem. Just wanted to update you about my other piece of legislation, the Honor Our Living Donors Act. When I talked to you last time, I shared that it had been introduced in the House. It has now been introduced in the Senate, and we're hoping that that one will pass quickly. And just to give you some outstanding news, a few hours ago, I had a meeting with Speaker Emerita Nancy Pelosi. For those of you who haven't yet read about it, Nancy Pelosi's, Speaker Pelosi's husband, he was hit with a hammer by a home invader. He took a lot of pain medication, which destroyed his kidney. He was about to go on dialysis when their daughter, on the upper left corner, Jacqueline, donated her kidney to him, and Speaker Pelosi has agreed to be a bill co-sponsor. So I'm floating on air. I'm super happy, to have such an influential member of the House on our side. She really gets it, and I'm just delighted. Other people on the call include Dr. Chertow from Stanford University. He's a nephrologist. He phoned in from Denmark. Very grateful for that. And Leif Sigerson, a non-directed donor who donated a kidney to someone in South Dakota and hasn't met the person, but heard that person was super hard to match. I think it was 1 in 300,000 people would match with that person. And that's the power of a non-directed donor, to be able to be a miracle match for somebody that otherwise would not survive. Our next meeting is Tuesday, May 6th at 5 p.m.